Hi everyone. In this clip, I will continue with the subject of whooping cough. This is clip 3 of 3. Please note that anything I record here are for informational use only, and it is not intended to diagnose or cure any ailments. The functions of vitamin C and ascorbate in any toxin-mediated sort of disease, which includes tetanus, diphtheria, whooping cough, staph, strep A, shingles, etc., are numerous. The very common reason why people who are ill for a long time have extreme lethargy is the lack of vitamin C. We can't have functioning mitochondria without ascorbate. The frontline function of vitamin C is to neutralize circulating toxins, which is then removed from the body before being able to destroy tissue and disrupt normal fatty acids and cell function. With whooping cough, the body sort of manages the toxin with its antioxidant reserves until it runs out of antioxidants. Then the toxin builds up, the cough sort of intensifies, and there is breakthrough of toxins into the bloodstream. If you're using ascorbate to bind and neutralize toxins in whooping cough or any other ailment, you must use as much as the body will soak up to get all the functions going and complete the process. Everything you put in is quickly utilized to join with exotoxin and flush it out, to keep the neutrophils moving around and dealing with the waste, to keep the liver functioning well, to keep the mitochondria functioning properly, to keep the connective tissues intact, to cope with the coughing. So one form of vitamin C is called liposomal ascorbate. And when taken just before bedtime, it reduces coughing at night, and it can be used at the beginning of the cough in order to boost the blood vessels blood levels quickly. So now, the sodium ascorbate is initially dosed in milligram per kilogram per day fashion. I think you need to be sure that your sodium ascorbate is a non-GMO brand, obviously. So B-pertussis toxin exertion can be reduced to very manageable levels in 12 hours with correct ascorbate dosing. You have to continue to ascorbate for the whole time that the bacteria continue to make toxins, which can be up to 3 months. The starting dose in children for sodium ascorbate is usually 200 to 375 milligram per kilogram over 24 hours. But at peak of coughing, the dose needed in toddlers and older children can be as high as 1,000 milligram per kilogram per day in divided doses, and gently increased and later decreased when you want to wean off. If they're coughing until they are purple or gasping, then the doses are much too small or infrequent, so bump it right up, right? So if you use pounds instead of kilograms, know that 1 kilogram is equal to 2.2 pounds. So get a calculator and weigh the patient and convert their weight to kilograms to find out how much it is needed. Anyone who is not having at least 2 loose stools, not necessarily watery, per day needs more vitamin C. If they develop diarrhea, they will probably notice the cough is better just after that flush. That's not a bad thing, but we don't want anyone having ongoing diarrhea or becoming dehydrated. When flush happens, then either cut back the dose or given smaller doses more frequently. You may have to actually switch over to liposomal version if the loose stool is not stopping after one flush. So stop using sugar in your diet. This includes even honey, rice, carbs, and all good and bad sugar. Sugars compete with the vitamin C transporters in the cells, and if the cough is still bad, limit all sugar intake altogether. Pasteurized milk, for example, should be absolutely avoided. Some can tolerate fresh raw milk, but If it's worsens the cough, then you need to sort of stop that as well. Consider avoiding wheat and gluten for a few weeks, especially if you know that you have sensitivities to them. Now, please always try and read the labeled ingredients and try to avoid certain ingredients. For example, stay away from artificial dyes, sugars, oils, additives, preservatives. These are important for you to stay away from. If you stop the ascorbate too soon, you will quickly find the cough becomes much stronger. So ensure to follow the full term. Now, switching gears, metaphysically and spiritually speaking, the lungs are the organ that is most connected to the emotion of grief. The lungs interact with the outside world, breathing it in and letting it go. When we don't let go of our grief, it's almost as if it can fester in our lungs, causing congestion and exhaustion. Grief can certainly be about death, but it can also be about breakup, or moving to a new city, or a big life change. Even like something happy and positive, like having a baby, for example. It's wonderful. It's a wonderful event, but it doesn't mean it does mean that you're losing your sort of identity that you had before becoming a parent. All these are considered griefs, and more of those can sort of come by positive or negative experiences, and they deserve gentle attention and care. Grief itself is also generally hard on the body. Processing a loss can be exhausting. And even when we give ourselves the time and space to grieve properly, we are fundamentally more vulnerable to common coughs and colds and so on. It's important to sort of acknowledge our grief and give ourselves time to rest and feel our feelings. It's uncomfortable to do this, so many of us skip over this and try to distract or busy ourselves to get our mind off of our grief. When we don't give ourselves enough time to be with our grief, the body will often make us sick so that we can take that time because we needed it. So practice breathing deeply and ensure you're giving yourself the rest your body needs. Keep your body warm, especially in the colder, windier fall and winter seasons. Spend more gentle, loving time with yourself and your grief. And consider adopting a ritual or talking to a friend or a counselor, or however else your body and your mind need to sit with whatever you may need to sort of release. I hope even though not 100% complete, this has been of some help. Please ensure not to try and address any ailments you might have on your own, and contact your healthcare provider for proper steps and attention. Like and follow for more. Be the light.